Today, we're talking about pink bismuth. This medication is used to treat occasional upset stomach, heartburn, and nausea. It can also help with diarrhea and prevent travelers' diarrhea. Pink bismuth works by slowing the growth of bacteria that may be causing the diarrhea. It's important to note that if you have a fever or see blood or mucus in your stools, you should not use this product to self-treat diarrhea. These could be signs of a serious health condition, and you should consult your doctor promptly for proper evaluation and treatment if you have these symptoms. Pink bismuth is also used under a doctor's direction with other medication to treat stomach ulcers caused by a certain bacteria called Helicobacter pylori. It's important not to use this medication to self-treat ulcers. Bismuth subsalicylate, the active ingredient in pink bismuth, is a salicylate, which can cause serious bleeding problems when used alone in patients with ulcers. Always check the ingredients on the label, as the manufacturer may have changed them, and products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. When taking pink bismuth, it is important to follow the dosing instructions carefully. The dosage is based on your age, medical condition, and response to treatment. Do not increase your dose or take this drug more often than directed. If you are using the chewable tablets, chew each tablet well and swallow. If you are using the liquid form, shake the bottle well before each dose and measure the dose carefully using a special measuring device. Do not use a household spoon because you may not get the correct dose. It's important to note that this medication may interact with other medications, so talk with your doctor or pharmacist about how to schedule your medications to prevent any issues. If your doctor has directed you to use this medication daily, take it at the same time each day to get the most benefit from it. Make sure to tell your doctor if your condition lasts or gets worse, and if you are taking this medication for diarrhea, let your doctor know if your symptoms persist for more than 2 days. Side effects from pink bismuth are rare, but the most common ones are darkening of the stools and/or tongue, which are harmless and will go away when you stop taking the medication. If you experience vomiting or diarrhea that doesn't stop, it may lead to dehydration. Contact your doctor right away if you notice symptoms like decreased urination, dry mouth, fast heartbeat, or dizziness. Serious side effects are rare, but you should tell your doctor immediately if you experience ringing in the ears or hearing loss. In rare cases, pink bismuth may cause serious bleeding from the stomach or intestines. If you have severe stomach pain, vomit that looks like coffee grounds, or black/tarry/bloody stools, stop taking the medication and consult your doctor or pharmacist right away. A serious allergic reaction to pink bismuth is rare, but seek medical help if you experience rash, swelling, severe dizziness, or trouble breathing. This isn't a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking pink bismuth, it's important to let your doctor or pharmacist know if you have any allergies to bismuth subsalicylate, aspirin, salicylates, or NSAIDs. This product may also contain inactive ingredients that could cause allergic reactions, so be sure to speak with your pharmacist for more details. Additionally, it's important to discuss your medical history with your doctor or pharmacist, especially if you have a history of bleeding problems, gout, or phenylketonuria, PKU. If you have any upcoming surgeries, it's important to inform your doctors and dentists about all the products you are using. It's important to note that pink bismuth contains an aspirin-like product, so children and teenagers younger than 18 years should not take this product if they have certain illnesses or have recently received a vaccine. If you are pregnant or planning to become pregnant, it's important to discuss the potential risks and benefits with your doctor, as this medication may harm an unborn baby and cause problems with labor and delivery. It's also important to consult your doctor before using this medication if you are breastfeeding. As always, it's important to follow your doctor's recommendations and use the lowest effective dose for the shortest possible time, especially during pregnancy. It's important to be aware of potential drug interactions with pink bismuth. This medication may interact with valproic acid, carbonic anhydrase inhibitors, corticosteroids, dichlorphenamide, and methotrexate. It may also increase the risk of bleeding when taken with antiplatelet drugs, blood thinners, and other medications that may cause bleeding. Additionally, it's important to check labels of all prescription and non-prescription medicines carefully, as many contain pain relievers/fever reducers that are similar to pink bismuth and may increase the risk for side effects if taken together. If you are prescribed low-dose aspirin for specific medical reasons, consult your doctor for more details on how to proceed. Lastly, this medication may interfere with certain medical/lab tests, so make sure to inform all medical personnel that you are taking pink bismuth. Always consult with your doctor or pharmacist for specific details and recommendations. If someone has taken too much pink bismuth and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include ringing in the ears and hearing loss. If your doctor prescribes pink bismuth for you, do not share it with others. If you are taking pink bismuth for diarrhea, drink plenty of water to decrease the risk of dehydration. Consult your doctor or pharmacist for more details on the daily dosage and the best time to take this medication. If you happen to forget to take a dose of pink bismuth, just take it as soon as you remember. However, if it's already close to the time for your next dose, then it's best to just skip the missed dose. Take your next dose at the regular time. It's important not to double the dose to make up for the missed one. It's important to store pink bismuth at room temperature, away from light and moisture, and definitely don't freeze it. Keep it out of the bathroom and make sure to store it in a place where children and pets can't reach it. When it comes to getting rid of pink bismuth, don't flush it down the toilet or pour it into a drain unless you're specifically told to do so. Instead, make sure to properly discard it when it's expired or you no longer need it. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.